G'day, my name's Adrian Zacher, Chief Exec of the British Society of Pharmacy Sleep Services, and I'm delighted to be here to introduce you to Dr. Adam Patterson-Rathbone.
I'm Adam Patterson-Rathbone. I'm a lecturer in social and clinical pharmacy at Newcastle University's Faculty of Medical Sciences.
Thank you. And Adam's here to talk about the report that he's written about a project that we've run, that's the BSPSS, and the long-sounding title, Early Intervention Community Sleep Support. So, Adam, please tell us.
Yeah, so I want to start by saying thank you for inviting me to do the evaluation. The data that you collected was really great, and being able to get my head around it and come up with some understanding about what community sleep services might look like for pharmacists has been really interesting. But basically what we did was a single site kind of feasibility study with a small sample of patients, and what we wanted to do was look at what a pharmacist could do for somebody who might have a sleeping disorder like sleep apnea. For those people that don't know, sleep apnea is a condition that reduces the quality of sleeping. So people can feel tired, or they could struggle to sleep. But the data that's come out of this project shows that about 85% of the patients who had those symptoms who went to a pharmacy were willing to be screened. So about 85% were willing to be screened.
Is that significant?
It shows that the people that are going to pharmacies over a long period of time are having sleep issues, and they're willing to talk to pharmacists about their sleep issues. So that's a big group of people. Although in this study we did use a small sample, if you kind of scaled that up to the general public, that would be a lot of people. The screening that was done used a clinical decision support system, which was built from validated tools, and basically that asked people about their sleeping patterns and what symptoms they had. Of the people that were screened, about 60% met the threshold for home sleep apnea testing.
So what does that mean? So it means that some of them didn't merit a home sleep apnea test. They didn't need it.
Yeah, that's right. So some of these people, maybe they were feeling tired, but they didn't meet the threshold for a home sleep apnea test. So those people may have gone to a GP instead. They may have gone to another health service to ask about their symptoms. But instead here, they were seen by a pharmacist and told, actually, this isn't meeting the threshold for sleep apnea testing. Maybe it's something else that we can help with. But where patients did meet the threshold for sleep apnea testing, the pharmacist was able to offer that testing, so able to offer them a device to take home with them and do the sleep apnea test, and then bring that data back for the pharmacist to help interpret with them. So about 60% of those people that were screened met the threshold and were able to take a device home, and about 40% of people that were referred on to sleep services received a formal diagnosis of sleep apnea. So those are patients that maybe previously wouldn't have been able to go to a GP and get an appointment and then be seen. These patients went straight to the pharmacy, got screened, took the test home, and then were then referred to sleep services with all of that information already collected.
That was what the CDSS did. It actually ensured that there's some rigor, I suppose, and they captured the necessary data to make the next consultation informed.
Exactly, yeah. So it will have made the consultation with the GP to say, I've got a sleep disorder, I've got a sleeping issue, I've got a problem with my sleep. It would have made that a lot more informed and a lot more data driven, rather than the GP having to do all that work themselves, or a sleep service in a secondary care setting having to do all that themselves. So the takeaway really is that from this small feasibility study, we can show that, or we can say that pharmacists in a pharmacy can screen and identify people with sleep apnea.
That's a statement.
yeah.
Is it? That's good. Okay, so what does it mean for patients?
So at the moment, because this is just a feasibility study, we need to do some further research to identify the sensitivity and specificity and look at the cost efficacy of this type of intervention and this type of service. It does suggest that patients can go to a pharmacy, and rather than have an appointment with a GP or have to go to a private sleep clinic, that they would just be able to go to a pharmacy and have a consultation, which might make it easier for some people to access this type of screening and testing. So that broadens the access to sleep services for parts of the community.
And you've got the footprint that pharmacy has.
Exactly, yeah. There's lots more pharmacies than there are GP practices, and although pharmacies are closing and struggling a little bit at the moment, they're still really accessible places. You don't need an appointment. They're very local to people. People can walk to them. So they give access to this type of sleep service to a lot more people that maybe wouldn't be able to get into a GP to talk about this issue. I think a lot of people as well will feel that, like, being tired isn't necessarily something that they would go to their GP about, but it might be something that if on the off chance you're passing a pharmacy, you might pop in and say, look, I'm feeling tired all the time. Is there anything?
Well, you're picking up your meds, you're in there, you see that, oh, there's an opportunity to talk to someone about it. So.
Yeah. And what this study showed actually was that people that were already in the pharmacy, receiving other services and other like picking up their medicines, picking up prescriptions, they were already in the pharmacy, and this was like an add-on that they identified. So there were some people who were already in the pharmacy, but there were also some people referred to the pharmacy because they'd contacted NHS 111, for example, or they'd spoken to their GP about a sleep disorder, and they were referred to the pharmacy to get this sleep screening done. So it shows that it not only was the people already in the pharmacy who benefited from the sleep screening, there was people referred to this particular pharmacy specifically for the sleep screening.
Did you see a number of sleep disorders? I mean, what walked through the door?
Yeah, so the data isn't that granular. It doesn't give us that much detail in terms of what different types of sleep disorders there were, what patients were presenting with, but it does show that they were coming to the pharmacy with a sleep disorder, or that they were worried about their sleep and they were feeling tired. But further research that we would like to do would be able to delineate exactly what types of sleep disorders patients were coming in with, what type of symptoms they were having. I think that a big thing for patients, from a patient perspective for this study, is that there was a cost associated with it. So the patients had to pay for the home testing devices. And that's something that maybe, because this is just a small study and it was done in quite an affluent area, there's probably a selection bias in that we probably recruited the people who were willing to pay and who had maybe significant symptoms or symptoms that were disturbing enough for them to go and seek help. So because of that selection bias, we need to do a little bit more research. We need to get more pharmacies delivering this type of intervention to make sure that what we found is more generalizable to the public.
What does this mean for pharmacy? What does this mean for pharmacists themselves?
I think we can all really appreciate that pharmacists and pharmacies as businesses are really under a lot of pressure, dispensing more medicines than have ever been prescribed before, with limited resources, and they already have really, really busy workloads. So again, we'd need to do more research to identify what type of impact this might have on the pharmacists themselves, the pharmacy technicians, the assistants working there, the business as it is, and how this might impact the pharmacy workloads. What we do know, though, is that this study was done over a long period of time and recruited a relatively small sample. This may not be necessarily a huge influx of patients coming in, but it would be like a steady stream of patients coming in, who were, coming in with a sleep-related issue, who was willing to be screened, and in this case, were willing to pay for that test. So there's definitely a patient need that pharmacy could fulfill here, by offering this type of service. I think the real issue for pharmacies is about who's going to pay for this service. So obviously in this study, as I've said, patients were willing to pay for those tests. And in the future, if we get more research done and we can show that this is a cost-effective intervention, it could be a commission service, and that means it would be free for patients. The consultation would be, the pharmacy would be paid for the consultation, and that obviously gives pharmacies a new revenue stream, which makes them a bit more sustainable as a business, and again just supports that whole transition from pharmacy dispensing medicines to pharmacy delivering patient-facing services.
Do you think then, I mean, okay, it's hard to say because it's with accepting those limitations, did it look like a service that would meet the requirements, so meet the standard for commissioning, perhaps?
Yeah, I mean, that wasn't something we specifically looked at for in this study, so we didn't speak to commissioners, we didn't
No,
speak to
no.
the payers, and again, we don't know about the cost efficacy of it. But what we do know is that, you know, this pharmacist and in this pharmacy was able to run this service over a number of years, had a number of patients coming in with sleep disorders consistently, and was able to offer this service and get those patients diagnosed with sleep apnea. So he, you know, was helping the patients.
What's your takeaway message from this?
So I think for me, the takeaway really is that sleep is a really big part of everyone's health and well-being. So it impacts lots of different diseases. If you've got other comorbidities, it's going to influence that. If you're otherwise fit and well, but you have a, you know, really bad sleep, you're going to feel rubbish. So it's an opportunity, I think, for pharmacy to really support the country with sleep issues. And so if pharmacists can help patients have better sleep, and support patients who've got things like sleep apnea as well as other sleep disorders, then this would be a really good incentive and an initiative for pharmacists to get behind.
Okay, so Adam, what does it mean more broadly then for the NHS?
So a finding which we weren't really looking for was that pharmacists had really limited access to secondary care data. So the only way they could find out what had happened to the patients they'd referred was to ask the patients themselves whether they had received a diagnosis of sleep apnea or not. So from an NHS perspective, I think really what we need is a bit more of a joined up service, so that when someone is referred to a secondary care sleep service or their GP, pharmacists know what's happened to them, and that will let pharmacists develop their own kind of referral skills and their own pathways. I think what really stands out from this referral data that we could get was that a lot of patients were waiting quite a long time once they'd been referred to a sleep clinic. And so those patients were initially just waiting for you know, their first appointment, or if they'd had the first appointment, they were waiting for a follow-up appointment. And so by being able to offer sleep services from places like pharmacies, the NHS really would be able to increase access to these type of services much more readily, and get more people who've got sleeping problems seen by a health professional like a pharmacist. But really, I think for the NHS more broadly, it needs to think about joining up the data sets that primary care professionals have, like pharmacists and GPs, with secondary care services like secondary care sleep clinics.
It's a really interesting one about the data. I mean, and the situation that this was running was a pharmacy embedded in a GP practice. So they had enhanced data access, but it still wasn't enough.
Exactly, yeah. So I think it was about 50% of the patients who were recruited in this study, once they'd been referred to a sleep clinic, we don't know what happened to them. We don't know whether they were referred on to other specialty clinics. We know that some patients were referred on to other specialty clinics like rheumatology. We know that some patients were given a diagnosis of central sleep apnea. We know that some patients were given a diagnosis of obstructive sleep apnea. We know that some patients were given other sleep-related diagnosis, but that is only for 50% that we have the data for. There is still this big unknown about what happened to 50% of the people that were referred. And again, that's why we need a bit more research and a bit more linking up between services.
So what would you do with that data then? I mean, how would that impact patient care? This is what we're talking about.
Yeah, so having that data would allow us to see whether the intervention, whether pharmacist screening and referring was sensitive enough to pick up the patients who actually had sleep apnea, or was just referring patients who didn't have sleep apnea, maybe just had another sleep disorder, or maybe was sub-threshold. So it lets you tell how kind of sensitive and specific the intervention is. It also, from a personal, professional perspective, as an individual pharmacist, it lets you reflect on your own practice and think, well, I referred 10 patients, and out of those 10, only one actually had sleep apnea. So maybe I'm referring people who maybe don't have symptoms.
Yeah. Okay.
Whereas if you had 9 out of 10 that were referred, you'd probably think my practice is really good. I can spot sleep apnea really clearly. So it's good from a personal, professional perspective, but also broader from an NHS or a service level, commissioner level perspective. Knowing how sensitive or specific the intervention is allows you to be confident that what you're paying for is actually what you're getting. You're not just getting a bunch of people referred to secondary care sleep services who don't need to be there.
Okay, and then so that leads me into then the comparative data. It would be really nice to be able to compare to a traditional route.
Yeah, and what we don't have at the moment is any sort of data set about how long people are waiting with, they might have a sleep disorder that they haven't mentioned to their GP. We don't know how long people are waiting before they go to their GP. We don't know how long it takes for a GP to refer to secondary care sleep services. We don't know how long it takes for people who have been seen once to be seen again or to get some sort of treatment. And so really that comparable data set that would let us say that this intervention, definitely is improving access, that data just doesn't exist yet. And that's why we need to do a little bit more research to get that data so we can see how long people are waiting before the access services. Once they're in services, how long it takes them to get a diagnosis and treatment. And then obviously what impact that has on the patient's life. So improving their sleep, is likely to improve their life and improve their, social life, their economic productivity, all of those things. So what we need is a bit more research, essentially.
Absolutely. So, I mean, we all know that the impact of one bad night's sleep, these people probably haven't slept well for years.
Exactly. Thank you for having me on today. If anyone's got any questions about the report or would like to offer this type of service, then please just get in touch with us. We're more than happy to answer questions.
Okay, so thank you very much. And that wraps this up. And please do have a look at Adam's report. You can contact us through bspss.org and all the details on the report. Thank you very much for joining us today. Thank you, Adam.